There are two main types of hearing loss: conductive and sensorineural. Okay. Now, conductive hearing loss is experienced when the conduction of the sound waves down the ear canal to vibrate the drum to make the ossicles move is impeded in some way. See, there are three tiny bones here called ossicles, and they actually magnify the sound reaching the drum 30 times. 30 times together. Conductive hearing loss is when the sound conduction down the canal to move the drums, to move the ossicles, is impeded. And how does that happen? It can happen due to earwax plugging up the canal. It can be due to a foreign body plugging up the canal, like in children with a bead inside the ear. It can be due to a bony lesion. That is, if a bony tumor occurs here and blocks up the canal. If there is fluid in the middle ear, so the fluid stopping the three bones from moving well. If there are eardrum problems, if the eardrum has a hole in it, so the sound waves, vibrations just go into the middle ear and don't make the eardrum move. If there are ossicle problems, that is, if the three bones are disrupted with ossicular disruption, or if a slap on the, too hard a slap on the face causes these three bones to dislocate, then you have deafness. Okay. The second type of deafness is called sensorineural, sensation of hearing and the nerve. That is to say, if there damage has happened in the nerve or in the inner ear, the cochlea or the vestibule. Okay. So this is the sensorineural type of deafness, and above anything to do with conduction is called the conductive type of deafness. In sensorineural type of deafness, it can happen due to inner ear defects in children, can be due to genetic variations in the structure of the inner ear in children. It can be due to jaundice of the newborn, and the jaundice affects their hearing. It can be due to aging, presbyocusis, that is to say, as we get older, we lose hearing. It can be due to loud noises, exposure to loud, noisy theater or jackhammer. Okay. Or it can be due to head injury, where a fracture involves the inner ear. Now, let's discuss a little bit about viral infections. In viral infections, a person may wake up in the middle of the night with a sudden loud ringing in the ear. Then he waits till morning, tries to get up and finds that he is dizzy. Okay. And then he goes to the ER and finds that he can't hear. Okay. Now, if the ER is astute, they'll give him steroids, antibiotics, and cold medicines and refer to us. Then he comes to the ENT clinic and we find that he's lost the hearing of one ear. What's happened in this case? In this case, a virus has gone up the eustachian tube and has attacked the inner ear, the organ of hearing and the organ of balance. This is causing him dizziness, this is causing him the loss of hearing, and the inflammation of the cochlea is causing that ringing. Okay. Now, if the patient has come to us within 2 months, we can attempt to reverse the hearing loss. But the earlier you come, the better it is, because after 2 months, it really becomes difficult to reverse the hearing loss. It becomes impossible. Okay, so 2 months is the basic limit we give to the patient. And of course, this range is being researched every day. And the earlier you come, the better. Within a few days is best. Within the very next day is best. Okay. Now, This is the booth in which we do our hearing tests, the audiometric booth. This is an ear with a hearing aid in it. Now this is the audiogram, that is to say a measure of the hearing. This axis, the y-axis, is in decibels, 10 decibels, 20 decibels, 30 decibels, 40 decibels. And this x-axis is in frequencies, hertz, from about 125 to 8000. So we test all these frequencies, and up to 20 decibel range, if the hearing is between up to the 20 decibel range, it's normal. Anything below that we regard as abnormal. Okay, and let's go to the next slide. Now look at this. These brackets show the hearing when the sound is being directly applied to the bone. These X's and O's show the hearing when the sound is coming from the outside and is trying to vibrate the membrane. Notice this gap. Okay, this gap, ideally they should be equal. Ideally they should be equal. But this gap occurs if there's something blocking the external canal, or if there's something blocking the movement of the ossicles. Okay, conductive. This shows typical conductive hearing loss. And look at this graph. The hearing is typically within 20, but it's sloped. It's sloped. There is loss of the high frequency here. This happens the older we get along in years. Presbyocusis. It could be due to mainly due to high frequency sensorineural hearing loss, exposure to very loud noises, etc. Now, why do ladies tend to complain that the men aren't hearing them? Let me explain. Now, this cochlea looks like a snail. That is, cochlea means snail in Latin. Cochlea is Latin for snail. It looks like a snail of exactly 2.5 turns. Not 3, not 2, exactly 2.5. The bottom turn is very thick, and here's the high frequency. Middle turn is thinner, and here's the middle frequencies. The top turn is very tiny. Here's the low frequencies. So ladies at the bottom, children in the middle, men at the top. Now, because it's shaped like a pyramid attached to bone, all the shocks that go through our body to hit the skull, when we run, jump, leap, shout, all come and hit the bottom turn first. And this is one of the reasons why, as we get older, we lose our high frequencies. Now, all of us lose our high frequencies. The ladies also lose it, the men also lose it. But because ladies' voices are at high frequency, men tend to stop hearing the ladies. And that's when the ladies complain that we are not listening to them. Okay, men are not listening to them. Now let's go to the next slide. So here I've explained what this is, and this is classical normal hearing, all within 20s. And so what's the treatment of nerve deafness? Of course, if there is sudden sensorineural loss, we give them steroids. If there's Meniere's disease, which I've discussed in another section of the website, if there's Meniere's disease, we do diuretics and a low sodium diet. Okay. Of course, if nothing else can be done, we prescribe hearing aids, like this one here, hearing aids. If children present to us with hearing loss, we advise that they be seated in front of the class so that they can hear better. Seating. Of course, surgery. In young ladies, roughly up to 30, this what is known as fixation of the ossicles could be the cause of hearing loss, where this stapes gets stuck to the oval window where it attaches. See, the stapes attaches. The stapes is the tiny bone which attaches to the inner ear. So if this bone gets overgrown by bony tissue. Happens especially in young ladies up to the age of 30. They have a conductive deafness, and we can treat that by drilling a hole in the stapes and putting a little piston in. Okay, that's called stapedectomy. That's surgery. Of course, there are other implantable devices, BAHAs, BAHs, and so on. Well, thank you for listening to me, and hope to see you soon.